Thank you for opening the video. Smile Trouble Consultation Room. Have you ever heard of the term cervical neuromuscular syndrome? It is also known as stiff neck disease. Stiff neck and stiff shoulders are a condition that many people experience, so much so that it is said to be Japan's national disease. Now, I would like to talk in detail about what should be done to treat cervical neuromuscular syndrome. Thank you for your understanding. People who use computers for long periods of time and people who use smartphones all day long to play games, email, or use SNS are more likely to develop cervical neuromuscular syndrome. My shoulders get stiff when I'm concentrating on my work. And my neck is also stiff. Neck stiffness disrupts the balance of the autonomic nervous system, resulting in various symptoms. Cervical neuromuscular syndrome has multiple symptoms, including headache, dizziness, panic disorder, menopause, chronic fatigue syndrome, hyperhidrosis, irritable bowel syndrome, autonomic imbalance, palpitations, and unstable blood pressure. Other psychiatric symptoms include depression, irritability, anxiety, decreased thinking ability, and sleep disorders. If you judge each symptom one by one, you will not know which hospital or department to go to. For headaches, I go to a neurologist. For dizziness, I go to an otolaryngologist. For neck pain, I go to an orthopedic surgeon. For palpitations and blood pressure, I go to an internal medicine or cardiovascular medicine clinic. For hyperhidrosis, I go to a dermatologist, and for mental symptoms, I go to a psychiatry, psychosomatic medicine, or mental health clinic. Masu. However, even after various examinations, they are told that there is no abnormality, and even when CT, MRI, and X-rays are taken, they are told that there is no abnormality. Even if they are advised to go to a psychosomatic doctor or prescribed medication, many people do not get better. Generally speaking, the things to be careful about to avoid stiff necks are to stay away from stressful environments, avoid sitting in the same position for long periods of time, do neck exercises, warm your body in the bath, and exercise moderately. These include exercising and eating a nutritionally balanced diet. However, if you are already experiencing painful symptoms, doing these things alone will not be enough to improve your symptoms. It is generally said that muscle fatigue and poor blood circulation are the causes of stiffness. When you put strain on your shoulder muscles, they become hard and stiff, compressing your blood vessels and impeding blood circulation. As a result, fatigue substances such as lactic acid accumulate, which stimulates the nerves and is thought to cause symptoms unique to stiff shoulders, such as stiffness, malaise, and heaviness. When stiff shoulders become chronic, they develop into symptoms of pain, which further exacerbates muscle tension and worsens blood circulation, creating a vicious cycle. However, our consultation office does not believe that the symptoms are caused by the stiffness compressing the nerves or blood vessels. This is because I have witnessed the reality that people who are suffering from symptoms do not improve their symptoms even after long-term treatment to relieve stiffness. In order to investigate the real cause, we need to know about the brain and nervous system. The neck is a very important part of your health. If you have stiffness in your neck that causes discomfort and pain, various symptoms will appear and interfere with your daily life. If you have tried various treatment methods or taken medicine, but your symptoms do not improve, there are some things you need to consider. This means that the treatment will not be effective unless it targets the true cause. The stiffness may simply be caused by the location of the stiffness in the neck and shoulders, and even if treatment is applied to that area, it may feel like temporary relief, but the symptoms do not improve easily. The real cause is not the stiff part. Cervical neuromuscular syndrome symptoms are caused by stiffness in the neck and shoulders. So, what is the cause of stiff neck and shoulders? The fact that the symptoms do not improve with treatment for location 2 means that if treatment approaches location 3, which is the cause of 2, the stiffness in 2 will also go away, and at the same time, the symptoms of cervical neuromuscular syndrome in 1 will be resolved. We will continue to improve. Should we treat the semispinalis capitis, splenius capitis, trapezius, levator scapulae, scalenes, and sternocleidomastoid muscles, which are within the scope of treatment in 2, or approach 3? The question is whether to treat it. The autonomic nervous system controls almost all organs. There are 2 types of autonomic nervous system, the sympathetic nervous system and the parasympathetic nervous system. The hypothalamus, located in the diencephalon, a part of the brain that surrounds the third ventricle and the brainstem, is the center of the autonomic nervous system. Sympathetic nerves originate from the hypothalamus, pass through the medulla oblongata to the thoracic spinal cord, and from there send out nerves to the periphery. Parasympathetic nerves originate from the brainstem and sacral spinal cord and send out nerves to the periphery. The vagus nerve, which emerges from the medulla oblongata, distributes from within the brain to the bronchi, lungs, heart, stomach, and intestines. Life is maintained by unconsciously regulating blood pressure, pulse, digestion and absorption, metabolism, body temperature, etc. In addition to regulating body temperature, the hypothalamus is the center of the endocrine system and controls the secretion of various hormones such as the thyroid and adrenal glands. Nerves are distributed from the brainstem to the periphery. Because the nerves are compressed somewhere along the way, various symptoms of cervical neuromuscular syndrome appear. And the location of the nerve compression is not the neck or shoulder, where the stiffness is compressing the nerve or blood vessel. However, it is generally accepted that when a nerve is compressed in a certain area, pain, numbness, or a feeling of paralysis will appear in the stiffness of the neck or shoulders. Skull, clavicle, ribs, cerebrum, brainstem, cerebellum, spinal cord, cerebrospinal fluid, dura mater, vertebrae, intervertebral disc, semispinalis capitis, splenius capitis, trapezius muscle, levator scapulae, scalene muscle, sternal chain. We have to think about where the real cause is in the mastoid muscle, skin, etc. This is where the nerve is compressed. If you suspect that you have cervical neuromuscular syndrome and your condition does not improve even after treatment, I would like you to think about what you should do. Even if you have stiffness in your neck or shoulders, if you are unable to feel any effect from treatment on the stiffness, consider the structure of the human brain and nerves and treat the actual cause of nerve compression. I hope you find a treatment that you can notice and feel effective. Skull, clavicle, ribs, cerebrum, brainstem, cerebellum, spinal cord, cerebrospinal fluid, dura mater, vertebrae, intervertebral disc, semispinalis capitis, splenius capitis, trapezius muscle, levator scapulae, scalene muscle, sternal chain. We have to think about where the real cause is in the mastoid muscle, skin, etc. This is where the nerve is compressed. People who are still struggling with painful symptoms and are desperately searching for where to go for treatment are trying to improve their important nervous system with the right treatment and live a healthy life for the rest of their lives. I hope you get it back soon. If you would like to know more about the actual location of nerve compression in cervical neuromuscular syndrome, or information on the correct treatment for the neck to improve cervical neuromuscular syndrome, please visit the Smile Trouble Consultation Office in the About section. Click on the home page URL. There is no consultation fee. We look forward to your call. Thank you for watching the video.